Laser, cryosurgery, and hilotherapy in oral and maxillofacial surgery. Laser is an acronym of light amplification by stimulated emission of radiation. The first working laser was used on extracted teeth was developed by Meiman in 1960 by exciting a ruby rod with intense pulses of light from a flash lamp. Since then, its medical and photobiological applications have been expanding. Laser beam is monochromatic. This means it has a single color or wavelength. Directionality. Laser light is emitted as a relatively narrow beam in a specific direction. The beam can travel a considerable distance with very little movement away from parallelism. Coherence. The ability to direct the monochromatic collimated photons in is called coherence. This allows the laser to be focused on a precise point via the delivery system. Brightness. This property arises from parallelism or collimination of laser light as it moves through space, maintaining the concentration and characteristic of brightness. Laser components. Active medium. Active medium is every laser device has a laser medium, a material or laser medium, either natural occurring or man-made. This material may be solid, liquid, or gas. The active medium is positioned in the laser cavity, an internally polished tube with mirrors coaxially positioned at each end and surrounded by the external energizing input. Pumping mechanism. This represents a man-made source of primary energy that excites the active medium. This is usually a light source like a flashlight, but can be a diode laser unit or an electromagnetic coil. Energy from this primary source is absorbed by the active medium, resulting in the production of laser light. Optical resonator. There are two mirrors. One is high reflecting mirror, reflects essentially 100% of laser light. The other is partially transmittive mirror, reflects less than 100% of laser light and transmits the remainder. Laser light is produced by stimulated active medium is passed back and forth through the axis of laser cavity using the two mirrors. Laser delivery system. The best laser delivery system is fine silica quartz fiber optic cable, maximizing the benefits of medical and dental laser to reach their target site. However, the suitability of this delivery system is conditional upon the emission wavelength being poorly absorbed by water hydroxyl groups present in the quartz fiber. Therefore, shorter wavelengths give rise to severe power losses through quartz fiber and hence require alternative delivery systems. Examples of them are articulated arms incorporating internal mirrors and prisms. Cooling systems. Heat production is a byproduct of laser light propagation. It increases with the power output of the laser, hence with heavy-duty tissue cutting lasers. The cooling system represents the bulkiest compound. Coaxial cooling systems may be the air or water assisted. 6. Control panel. This allows variation in power output with time, above that defined by the pumping mechanism frequency. Other facilities may allow wavelength change, multi-laser instruments, and print out of delivered laser energy during clinical use. This is the components of laser device and a picture of the quick laser machine that is the laser device used in our college. Laser tissue interaction. Absorption. The tissues absorb laser beam according to their characteristics, such as pigmentation and water content, laser wavelength, and emission. Chromophores are the compounds within the tissues which absorb the wavelength of light. The absorption is dependent on the amount of chromophores within the tissue. Dental tissues have different amount of water content by weight, ranking from lowest to highest, which show enamel, dentine, bone, calculus, caries, and soft tissues. In general, the shorter wavelength are readily absorbed in pigmented tissue and blood elements. Transmission. The inverse of absorption, transmission through the tissues, results in no observable laser tissue reaction. Laser energy passes directly through the tissue with no interaction between the incident beam and the medium. Reflection. The beam redirects itself off the surface, producing no effect on the target tissue. The density of the medium or angle of the incidence being less than the refractive angle results in total reflection of the beam. Scattering. Scattered laser energy is absorbed over border area of volume of tissue, thus diffusing effects on the energy. There is some interaction, but this is insufficient to cause complete attenuation of the beam. Scatter will cause some diminution of laser energy with distance. Photobiology of lasers. The interaction of non-ionizing radiations with biomolecules and the resulting biologic reactions is known as photobiology. The major reactions are photochemical, which include biostimulation, which means laser effects on biochemical and molecular processes that normally occur in tissues such as healing and repair. and photodynamic therapy, which is the therapeutic use of lasers to induce reactions in tissues for the treatment of pathologic conditions, and photorescent or re-emission or tissue fluorescence, which may be used as a diagnostic method to detect light reactive substance in tissues. Photothermal interaction manifests as photolabation and photopyrolysis. Photolabation is the removal of tissue by vaporization. Photopyrolysis is burning away of tissues. Photomechanical interaction include photodisruption, which is breaking part of structures by laser light, or photoacoustic interaction, which involves the removal of tissue with shockwave generation. Photoelectrical interaction include photoplasmosis, which describes how tissues is removed through the formation of electrically charged ions and particles that exist in semi-gaseous high-energy state. General classification of laser. Class 1 are non-hazardous producing laser. Class 2 is relatively safe but is hazard when passed through magnifying optics. Class 2M is relatively safe if not viewed through optical instruments. Class 3 is safe with restricted beam viewing. Class 3B, direct viewing, hazardous to the eye. Class 4, serious injury potential to the eye and skin, which is the most dangerous classification. Classification according to the medium used. Solid-state lasers have lasing material disrupted in solid matrix. Example, the ruby or neodymium YAG lasers. Gas lasers. Helium and helium neon are the most common gas lasers which have primary output or a visible red light. Excimer lasers use reactive gases such as chlorine and fluorine mixed with inert gases such as argon. When electrically stimulated, a pseudomolecule or dimer is produced. Dye lasers, it uses complex organic dyes such as rhodamine 6G in liquid solution as lasing medium. Semiconductors, it's also called diode laser. It's fully based on semiconductor gain media. Advantages of laser. Laser unit is compact, economic, easy and safe to handle, also no need for suturing. Improved surgical versatility over with conventional methods. Ability to coagulate, vaporize or incise tissue. No need for local anesthetics or antibiotics, analgesics or anti-inflammatory medication. Laser reduce or eliminate bleeding. It also seals the blood vessels. Electrosurgery requires high powers, but laser can achieve tissues incision at the 100 times lower average power. Low level of discomfort, rapid repair. Disadvantages. Hazardous to the patient, operator and assistant team. Expense of laser equipment. Maintenance requirements. Specialized instructions for the use of laser equipment by operator and assistant team. Technical difficulties. Oral surgical applications. Oral surgical applications of laser are as follows: white patches and pre-malignant lesions. Nutritional deficiencies such as iron or vitamin B12 should be treated. Patients must be strongly advised to give up smoking. If lesions doesn't respond and excision is required, the CO2 laser is a good option. Erythroplakia and pre-malignant leukoplakia. Mildly dysplastic superficial lesion can be treated by ablation. Severely dysplastic lesions need a deeper excision and is then advisable to use the laser as a knife so that the whole lesion can be sent for histopathology. Erosive lichen planus. Erosive lichen planus that doesn't respond to any other treatment is occasionally treated by laser with some success, but this is best considered as last resort kept for patients with severe symptoms. Denture-induced hyperplasia. This is a common condition that is very suitable for laser treatment, especially if it is extensive. The denture should be adjusted and left out as much as possible for several weeks so that extent of surgery can be decided. Squamous cell carcinoma, small tumors in the floor of the mouth, can be completely resected with a wide margin. Other lesions include the submandibular ducts can be divided with little chance of postoperative salivary obstruction. Small tongue lesions can be excised with laser alone, except for the larger blood vessel can be troublesome.
Cryosurgery is the technique of using extreme rapid cooling to freeze and therapy destroyed tissue. Rapid cooling to temperature below freezing point to produce a localized destructive effect than slow freezing, which cause generalized tissue necrosis. The effect of rapid freezing on the tissue are reduction of intracellular water, cellular shrinkage, increased concentration of intracellular solute, cell membrane damage, formation of intracellular ice crystals, formation of extracellular ice crystals. Cryosurgery apparatus This old cryosurgery unit, nitrous oxide cylinder, cryoprobe, warming cycle light, freezing cycle light, foot switch, and the new surgical unit on the cryosurgical unit. Cryosurgery application: lesion, edema, papilloma, granuloma, epulis, warts, small sarcoid, leukoplakia, facial pain, TMJ, and oral cancer. Cryosurgery application: Zan thalassemia, viral rats, and solar keratocytes, and erosive lincha planus. Basal cell carcinoma, and this aggressive jaw lesion. Now we have the technique of this. Surgery. It's used in treat of many type of skin lesion. We use liquid nitrogen as a spray and cryo tweezer. And this is the cryo tweezer. This is a cryosurgery with liquid nitrogen on a common wound found on the girl finger. Cryosurgery is being performed with a cracked tracker cam to treat large separate keratosis on the forehead. When the temperature drops below 0 centigrade, the sensor light turn green, as we see. We should take care to follow the periphery of the lesion. On this, the cryosurgery is being used in the actinokeratosis on the face with pen tip extension spray in 10 seconds. In this case, the cryo tweezer is applied to a skin tag in the neck until it becomes white. Note that the cryo tweezer is held with cotton gauze to prevent freezing of the hand of the physician. Now we have hilotherapy. Hilotherapy is the application of cold compression at a regulated temperature through a face mask. Studies that have evaluated its efficacy have focused on a post-operative edema pain and the patient comfort. Hilotherapy uses prefabricated facial contoured polyurethane mask to channel a current of cool, sterile water adjacent to the skin to provide a regulated cryotherapy. Preoperatively, it's provide a way of standardizing cryotherapy can be evaluated in a randomized controlled trial. This video shows the cool mask that we use after surgery to heal faster and remove all the swelling. That's it. Thank you.